Good evening, everyone. We'll wait for some time and start in a short while. Is my video audible and video and audio both are available? Are you able to see this screen over there? Are you able to see the screen properly? Hello? All right. So we are entering into GSC NPO week 7. My name is Dr. NAVANEET, and today's global health care and non-profit organization subject. The first topic is moral issues in healthcare. The second is ethical dilemma during COVID-19. Digital healthcare and ethics. Then we cover governance in healthcare and ethics in support mechanism. Then building ethical partnership, global healthcare impact. So the kind of ethical issues which healthcare professionals are facing, it is also related to moral issues in healthcare. So the 4 pillars of medical ethics are autonomy is the first one. So autonomy ensures patients have the right to make informed decisions about their treatment. Beneficiaries require healthcare providers to act in the ways that promote patient well-being. So non-malfeasance emphasizes the duty to avoid causing harm. Justice guarantees fair and equitable access to care, regardless of socioeconomic status. So, these are some of the 4 pillars like autonomy, beneficence, non-malfeasance, and justice. So, these principles form the foundational pillars of medical practice and guide the decisions in complex real life scenarios. I think somebody's audio is on. The 4 pillars of medical ethics means the patient should have autonomy, the receiver of the healthcare benefit. Beneficence means requires healthcare providers to act in ways that promote the patient well-being. Non-malfeasance means duty to avoid causing harm. And justice guarantees a fair and equitable access to care, regardless of socioeconomic status. So, for the ethics, for the people to be continued, these are the principles that form the foundational stages of ethical medical practice and guide decisions in complex real world scenarios. So each principle is not just a rule but a moral commitment that shapes how care is delivered and how professionals interact with patients. So here, a lot of care has to be taken by healthcare professionals in order to know what is autonomy and what is equity. So, for example, end of life decision dilemma. So people, for instance, in a rural clinic, a patient with a terminal cancer requests to discontinue the life support. He is asking that let him die in a casual way in what he is entitled to. So the family insists on continuing the treatment, fearing death will bring shame. So the doctor faces a dilemma whether to listen to the family members or listen to the patient. So we have to respect the patient's autonomy or uphold the family expectations. These kind of dilemma usually happens at the end of life. So this case highlights the tension between individual rights and the family pressures at the end of life situations. And decisions have to be taken based upon these four pillars of principles. Next is justice in resource allocation. In a high income country, a wealthy patient refuses life saving transplant due to cost. The hospital must balance the justice in resource allocation with the principles of beneficence. So they need to allocate the resource in case if they have, in case if it is not affordable for some patients, then justice in resource allocation also has to be understood. This scenario raises the questions about equity and whether access to life-saving treatment should be based upon financial status. So there is a lot of debatable issues as to whether resource allocation has to be in favor of the patient or the government has to take care of all those things. But this is one principle on which people have to be taking a decision and bring balance, because most of the people tend to have their own behavioral traits based upon which they will take decisions. So, where morality meets medicine, common ethical challenges that every patient faces. One is informed consent. So, the patient has to give consent, and his attendant or accompanying person also has to know what he's undergoing through. So, the informed consent is a cornerstone of ethical care. Patients must understand risks, benefits, and alternatives before agreeing to the procedures. So he should know the outcome. If everything goes well, all is well. Otherwise, sometimes there could be side effects. All of the things has to be made known to him in his local language. Then, without clear communication, consent becomes invalid. If somebody is trying to hide the information or just suppress the information, so it may lead to misleading information, and failure to disclose also complicates the situation and can lead to legal and moral violations of the patient rights. So, for example, a patient undergoing surgery may not be fully aware of the potential complications like the infection or paralysis. Ethical practice demands the transparency even when the news is difficult. How to digest this news and go ahead with kind of treatment, whether surgery for such a patient is required at different stages. So, healthcare providers must ensure that consent is voluntary and it should be informed and documented to uphold the patient dignity and trust in the medical system. So some people, although they are very rich, they try to go to foreign countries, or rural folks normally go to cities, and people who are already in the cities they go to abroad in order to get the treatment in case if it is affordable for them. But more than anything else, informed consent and patient rights have to be seen from the perspective of dignity, patient dignity and trust, and respecting the patient choice, the subject matter of moral and ethical standards. For instance, there have been a lot of debatable issues about abortion and maternal autonomy. A young woman seeks an abortion during her early pregnancy. Her doctor explains the risks and options, but she feels the societal pressure to carry the child. So the doctor respects her autonomy while offering the counseling. So what to do and what not to do has to be respected. This case reflects the moral complexity of balancing maternal rights with the perceived sanctity of life. So whether living or giving birth to a child or making it live or allowing the mother to take her own independent decision is a matter of maternal autonomy. Then comes religious objections and vaccine refuse. A patient with a rare disease refuses to a vaccine due to religious beliefs because he thinks the healthcare team is trying to provide education in a modern way and support the decision, ensuring no coercion or no force is done from the modern perspective. But he still believes some religious beliefs prevent him. Like, for instance, it may be containing non-veg, and in an injection, it's made up of various ingredients for which he is refusing due to religious objections. So this illustrates how respecting patient autonomy, even in controversial cases, aligns with the ethical standards. So, due to religion or some and due to culture or tradition, some people may have a refusal kind of mindset. But at that time, it becomes a moral or ethical standards to ensure that what kind of decisions are in his favor. Then comes the technology and the future of medical ethics. AI and genetic engineering in healthcare. So over a period of time, we have seen not only in vegetables or even animal grown, but also healthcare genetic modifications are done. Artificial intelligence can analyze the data faster than humans, but it lacks empathy and moral judgment. So it doesn't have a feeling. So there, it assumes that every judgment is crucial for the patient as much as it is for the family. So if AI misdiagnoses a condition, who is responsible? Whether the developer of the AI himself is responsible, or the hospital staff is responsible, or a doctor becomes accountable. So these are the questions which arise in between the moral and ethical standards. Genetic engineering, such as CRISPR, allows editing of human DNA, and to how much complex outlook does one have towards changing the DNA itself. So while it could cure diseases, it could raises the fear of creating designer babies. So you might have seen, if the new baby has to be born with a blue eye or a fair skin or something like that, it is in fact deepening the social inequality which already exists. So genetic engineering, in a way, it could be harmful if that if they are not balancing the decisions with autonomy and respect. So these technologies demand a few ethical frameworks that go beyond traditional principles, focusing on accountability, that who ultimately is accountable for undergoing such changes, both at the cosmetic level as well as the treatment level. So equity and long-term social impact also has to be seen from that angle. In a way, in a long-term basis, how the patient will be seen amongst the public is also crucial, and because he himself does not know that in the future who will look at him in what manner. So AI and genetic engineering in healthcare is also one of the moral and ethical issues that needs to be dealt with by the workforce working in the healthcare sector. Then comes technology's moral limits. AI bias. AI comes with its own bias, and there's a lot of mistrust, especially the clinical trust, which is depleting in some cases. For instance, AI algorithm recommends a treatment plan for a cancer patient. It gives all the solutions, but it underestimates the patient risk. It doesn't know what is going to happen with the patient just because it is accepting an AI algorithm. So the doctor overrides the recommendation and emphasizing the human judgment. So that's where the human mind has to have emotional balance in during such cases, whether to listen to what AI algorithm is saying, or the doctor has to override the recommendation, emphasizing the human judgment wherever possible. This case shows that AI must be used as a tool, not as a decision maker. Finally, it is a human who has to take ground in order to have sanity while taking decisions, not leaving all the decisions to be left for the AI to take care of, and leave the health of the patient in the domain of AI. So, to preserve patient safety and moral responsibility, it becomes the limit at which one has to stop. So, genetic editing and natural order is another thing. So, a research team proposes editing genes. So, you have a genome. For instance, the entire India is having one, let us say, one entire genome, in which some people want to try to find out what is a hereditary disease. Parents agree, but the critics argue that it violates the natural order because you are interfering in the affairs of what constitutes natural as of now. So, this highlights the need for public debate and ethical oversight before such technologies are widely adopted. Then, the role of healthcare professionals in ethical practice, it is all about not only knowing the principles and procedures, but what has to be practiced as an ethical practice has to be considered in order to bring about best practices in hospitals. So let's come to question number one. Patient decision is right means, is it beneficence or autonomy or justice or non-malfeasance? ABCD. This no one is answering. Let me see. The correct answer is autonomy. Patients choose the treatment. So patient decision is right because of the autonomy of the patient. Second, end of life dilemma is what? Is it about cost versus care, or is it about autonomy versus family, or it is technical issues versus ethical issues, or is it the law versus the religion? Let's see the answer: autonomy versus family. Because family may have its own whims and fancies that the person should live long, but patient himself knows internally that let him keep the support aside and let him live alone. So conflict between patient and family, autonomy versus family is the correct answer. So end of life dilemma is not about just cost versus care. It's not just about technical versus ethics. It's not just only about religion or law, but it's about autonomy versus family. So now coming to building trust through integrity, navigating a moral challenge during a global pandemic. Topic number two, ethical dilemmas during the COVID-19 pandemic. During the COVID-19 pandemic, as we have all seen, resource allocation was hampered. And during the peak of the pandemic, hospitals faced severe shortages of ventilators and even oxygen cylinders and ICU beds also. So the medical teams were forced to make life or death decisions on who received the life treatment. And these triage protocols often prioritize patients with higher survival possibilities, raising ethical concerns about unequal treatment. So just because people did not have certain aspects or tools, then unequal treatment was given to them. While utilitarian models aim to save most of the lives, they clash with the moral principle that every human life holds equal value. So we cannot say just because a patient doesn't have a bed to sleep on, his life is less value. Or just because a patient who doesn't have an oxygen cylinder, his life is of no use. So these kind of resource allocation in critical care became challenging situation whereby the lack of clear and transparent guidelines added to the emotional and professional burden on healthcare providers. So these triage decisions are balancing medical logic and human values. So in a crowded ICU in India, a team had to choose between two patients, one with a high chance of survival and another with a lower chance with a stronger family connection. The decision was made based upon the medical criteria, but it sparked public debate about whether family ties or medical outcomes should guide the triage. So, while taking a decision, all these also resource allocation matters a lot. It happened when the pandemic had caused a heavy toll on the number of people who became casualty. So, two ethical frameworks in resource triages. Utilitarian approach is one approach through which you are going to allocate the resources. Another is equity-based approach. So, in utilitarian approach, in contrast, in a US hospital, a triage protocol was implemented that prioritized patients based on age, comorbidities, and likelihood of recovery. So, they decided if the a person's already spent most of his life and is in towards the fag end of his life, so they were given second priority than people who did not have comorbidities. So this approach was seen as a more efficient, but raised concerns about devaluing the older patients because they are respectable patients and their experience is valued, and those with chronic conditions. So whether the one who requires most attention is the one who is having chronic condition, or the one who is uh, just young enough or may not be able to pay the balance of charges also was has to be taken into consideration. So utilitarian approach is one way of looking at things. Another way of looking at things is equity based approach. So favors patients with the highest probability of survival. It tries to see who is likely to lead the life, aiming to maximize the overall outcomes. So it kind of a person who is right, survival of the fittest kind of thing. It fits into the equity based approach. Another is utilitarian approach. So these two are there, which go like a continuum. We are somewhere in the middle in the healthcare professionals, in which they have to see which approach is suitable for which ideal circumstances. Now, another thing is during the COVID-19 pandemic, frontline workers and the burden on each one of them, they had to slog in a hard number of hours daily. So, healthcare workers often operated without sufficient personal protective equipment, and they had to literally wait, increasing risk of infection. So the circumstances under which they were working, PPEs were lesser. Many reported severe mental health issues due to prolonged exposure and emotional strain. So institutions failed to prioritize worker safety and creating a moral failure in duty of care. So people who are taking care somehow suffered a lot. And the strain on top of which this highlighted the ethical responsibility to protect those who serve the public health system. So this kind of burden of care was visible during the COVID-19 pandemic. Now, we have seen, apart from this, the global inequity in vaccine access. Yeah, are some of the examples apart from the ones which are faced directly by those who are in charge. For instance, wealthy countries secured large vaccine supplies earlier because they had the power of money. They bought all the vaccines. They were the people who assumed that their vaccines are best, whereas the other countries, including India, when we made a vaccine, they started blaming that of lower quality. So vaccine distribution disparities between rich and poor nation also emerged during those situations through which many people have gone through. Then another thing is, in a rural area, developing nations face delays and shortages, and even research and development. Luckily, the R&D people were able to adopt quickly, but then there were shortages in the rural areas, unlike the city areas. So the role of non-profit organizations in all this is nothing but delivering the medical supplies, the PPEs, the awareness campaigns to the underserved regions, their ethical commitment of fairness, inclusion, compassion, which helps to bridge in the healthcare access. So organizations like MSF, Medicine Sans Frontier, and WHO, World Health Organization, partner with local communities to ensure culturally sensitive intervention. These efforts demonstrate that ethical action can drive efficient, effective, and equitable responses during the crises. So building ethical foundations in crisis management becomes important. Justice, transparency, and accountability must be at the central decision-making level. So ethical principles will guide emotional, also not only does intelligence but humane approach. Now, establishing ethical governance in health systems, people have to be given clear guidelines, a visual aid or a guide in respective languages, what to do and what not to do. So prescription only, behind the counter, pharmacist intervention, pharmacy only, unscheduled general sale. So anything that of that sort, like in case of COVID-19, you might have seen social distance, cover the mask, wash your hands, keep distance, and get yourself vaccinated, or sometimes even isolated in various quarantine. So some ethical governance is required in order to do the guidelines. The governments must establish clear and publicly accessible ethical guidelines for crisis decisions, and it should be the same throughout the state and throughout the country wherever ethical governance in health systems is required. So those should include triage protocols, worker protections, and data governance standards. All of them requires immediate attention for the top management in order to take decisions for betterment of health systems. Now, some of that could be transparent communication, like openness and transparency and visibility amongst all the members of the general public. They should use only one app. Like Slack is the one app which has come recently, SLECK Slack, which makes the organization department to stay together, like no matter whether it's HR or finance or other supporting departments or the operations, ICU, and each and every department, including pharmaceuticals, all of them, they should have shared dialogue, shared knowledge. So Slack is one such commonly used platform on which people remain accessible and they are timely in taking decisions by keeping one another known about what kind of decisions have been previously taken. Next is accountability is what makes people take responsible decisions. So if the person is not held accountable, only people are going to blame the top level management without adequately equipping oneself with their decision making ability. So ethical decisions also involve a lot of support from the communities, which improves nevertheless ethical outcomes from all the people concerned in the team. So team, it's a team effort, and team management and formation of the team have to be put prior attention. Then comes your third question. COVID triage basis is about what? Is it about wealth? Is it about survival? Is it the status or is it the age? Any guesses? Okay. Survival, survival, survival. Okay. COVID triage basis is about survival because we have to ensure that maximum people live and come out of the pandemic. The correct answer is COVID triage basis is about survival rather than wealth status age law. Next comes vaccine inequity issue. Is it about speed that there is inequity, or fairness, or tech, or infra? Okay, let's see. Somebody say fairness. Yes, it's a global equity issue. Everyone should get vaccine. It's not about that where there is a lot of speed only the vaccine has to reach, or where the technological development or infrastructure is there only the vaccines have to reach. Vaccines have to reach as an idea of fairness that everybody should get the vaccine. So it's a global equity issue. Next is the next topic is digital healthcare, privacy, equity, and accessibility. So anyway, thank you for all the people who have answered. Now, next on digital health. Digital health integrates information communication technologies (ICT) into the healthcare delivery, enabling remote consultations and real time monitoring and data driven decision making. Technologies such as telemedicine, wearable devices, mobile apps, and AI. All the four things: telemedicine, wearable devices, mobile apps, and AI. All these are reshaping how patients are interacting with the healthcare providers. So it's not just one-to-one face-to-face discussion. These tools improve access, especially in rural or underserved areas, and allow continuous health tracking beyond traditional office visits. It reduces the multiple visits that one needs to go to the clinic or hospital. However, their widespread adoption raises critical ethical questions about the data ownership, data privacy, data inequitable access. So without proper safeguards, digital health risk the deepening existing health disparities. So it is, in a way, creating a divide, digital divide, what we say, or exposing vulnerable populations to misuse of personal information. So the data which has been fed, we don't know whether the real patient himself has entered the data or someone relative or a friend has put or something else. So these issues become so significant for spying and getting the real time data in its all truthful nature as if it were original. So, telemedicine is all about bridging this gap in accessibility. So, telemedicine has become a lifeline during pandemic, allowing patients in remote regions to consult the specialists without having to travel either from rural to urban areas or from urban to foreign. So, this model reduces barrier related to geography and cost, especially for chronic diseases management. People are using Zoom and specialized health apps, which have enabled real-time diagnostics and follow-ups also, and improving continuity of care is possible due to telemedicine. However, concerns about data interception, that if somebody is getting both the conversations between the provider and the receiver of the information, if there is some intercepting mediator who is taking advantage of such conversations, is also a breach, or it's also a kind of safety and security issue, and with a lack of patient consent in some cases, that he agrees that he is not a robot, he is a human, and he has logged in with encryptable all user IDs and password without third party necessity of authorization. So all this becomes an issue of ethical and moral grounds. Next comes artificial intelligence in healthcare. So promise and pitfalls. AI in diagnostics. So nowadays, we have seen a real latest case, as you were saying, in some high court. Some judgment has been taken in which AI has given all the verdict, and people are trying to know whether it was a judge who has really based on the case's evidence or the AI itself has done this. So the same case in case of healthcare, AI in diagnostics, AI-powered diagnostic tools analyze medical images. The moment you put a medical image, for example, some hemorrhage, so if you put that image, it directly gives its responses, whether it is an early stage disease or some in cases whether diabetes or early stage cancer. These systems can process vast data sets faster than humans. So you, without having to visit anyone, it is able to track the real time improvement of early detection. But however, if trained on biased data sets, if it's working on some biased data sets, if the training given to that AI is wrong, then AI may at times misdiagnose a patient from underrepresented groups and leading to unequal outcomes. So the way in which you are going to ask the question to AI makes of the whole lot of difference in whether it is going to give you the correct answer or little hazy answer. So this highlights the need for transparent and auditable. This is most important. So it not only should be transparent, it should be auditable by third party, and it should be an inclusive AI development, which should be able to be interpreted by the people concerned. So AI and diagnostics is subject matter of discussion for moral and ethical grounds for decision making. Then there is ethical risk for AI bias. So AI tools can detect patterns in medical data that are invisible to the human eye. So that what we cannot normally see with the human eye. It is enabling earlier interventions. So, for example, AI has shown high accuracy in identifying skin lesions or predicting heart failure from EHRs. So, from the employee health records, we are able to find out who is strong, who is not so strong. And these tools support clinicians, but not replace human judgment. So, even for the sports, so the people who are playing the match may not be able to know whether some kind of error has been happening, but we sitting as an audience, we are good in deciding who's going to play next and what kind of demand we can expect runs to be scored. So similarly, the bias with the AI is attached so much that something that the human cannot interpret or even see might be able to be captured by the AI, and that creates a bias while taking a decision. But finally, human judgment is what one has to go ahead with so that they can avoid pitfalls and not enter into unnecessary troubles because of AI. So patient empowered through these kind of mobile health apps. So people talking to one another regarding chronic conditions or hypertension or diabetes by tracking the symptoms or medications and lifestyle habits. So these tools actually are used to promote self-care. So over a long period of time, they should know what their sugar levels are or BP is. However, many apps lack data encryption. So there are apps by what like watch you can wear and it will calculate how many walks or footsteps it will calculate. Similarly, heartbeat or each and every device which is coming up new because of the use of AI and IoT and sensors. It may collect unnecessary personal data even without consent because of habit it has been able to do so. So this undermines the trust and exposes users to data exploitation, especially among older adults. Okay, someone who doesn't know how to operate a particular mobile also will end up basing his decision completely on what the app is going to tell. And the lower income populations, of course, the condition is pathetic because they are able to dupe anybody telling that he is under dire circumstances because completely believing into what the generation of reports have been to mobile health apps. So patient empowerment has to go along with educating awareness and to creating healthy competition amongst not only the patients who are receiving the benefit but also providers, and creating level playing field between the providers of the service and the recipients of the service. So patients empowerment is more important than just giving information. Because endless, huge lot of data and silos, it becomes humongous information, and person will take care of only one thing. If turns out to be negative, then he will catch with that negative information, and then he blames the doctor that his medicines are not good or something like that. So one has to know what kind of leverage these medical health apps can be put to. Next is ethical foundations in digital health delivery. So one is about data protection, like usage of antivirus, shields, protection of various apps, cleaners, ensuring data protection for vulnerable users. Then securing the health data in telehealth platforms. Just like money, health is even more important. So protecting the data, following the rules are all equally important and lays the foundations for creating a better digital health delivery. And people who are vulnerable, like disabled or specially challenged, inclusive design also has to be there in the physical spaces, apart from in the digital, the physical spaces in which the designing of the entire uh, areas have to be comfortable, not only for men but women, for children, for the disabled, for partially able people. So these kind of foundations have to be laid for the healthcare professionals so that they can offer the services in a better. So let's see one case. So, in a rural health Indian initiatives, an AI algorithm was deployed to screen for diabetic retinopathy using smartphone images. While the system showed high accuracy in urban populations, it failed to detect early signs in patients from tribal communities due to differences in skin tone and lighting conditions. So the AI was trained primarily on data from urban fair skinned individuals, leading to significant underdiagnosis rate among darker skinned patients. This case highlights the ethical failure of using biased training data, violating the principles of justice and digital health. So, how AI has been trained, under what conditions, and how many representative samples this AI is can generate images is based upon past treatment or training of the AI algorithm. So patients from the marginalized community were left untreated, and the project was eventually paused after the public outcry. The incident underscored the need for diverse representative data sets and mandatory bias audits in AI healthcare tools. So it calls for representations from all the sections of society, whereby AI can work amongst all sorts of people rather than only meant for certain specific type of outlooks or look people having some features. Then privacy violation in digital health platforms. Now, a popular telehealth app in the US collected patient data, including voice notes, medical history, and location information without clear consent. So, in 2022, a data breach exposed records of over 1.2 million users. Their voice was collected even without their approval. So, the breach was attributed to the weak encryption and inadequate user privacy policies. The end to end encryption was not completed, it violated the basic information uh, transaction. So the affected patients faced reputational harm, anxiety, and financial loss. The company faced regulatory fines and lost public trust. So these antitrust laws are there in US. This case illustrates the violation of autonomy and non-malfeasance in digital healthcare. So it also revealed a gap in transparency. So people who were told that it is a transparent, it became too transparent because it was known to general public who were not expected to know everything. So users were unaware of how the data was shared with third-party advertisers, and including insurers, medical representatives, and all those people who are taking advantage of providing generic medicine, all those things. So the incident prompted stricter compliance with HIPAA and GDPR regulations, emphasizing the need for robust data governance and informed consent protocols. So this can happen in rural India. This can happen in very well developed country like US because of overexposure to certain health telehealth apps. So the path forward could be little bit towards innovative ways of dealing with things, which requires action. Now, the key takeaways what we have seen today is digital healthcare offers immense potential to improve the health outcomes, especially in underserved areas. Our ethical responsibility must guide every stage of development. So rather than just giving simple treatment, it is every stage of development which needs to be taken from data collection to deployment. Privacy, equity, and accessibility are not just afterthoughts but foundational principles. Future digital healthcare system must prioritize transparency, inclusivity, and patient control. So governments also, along with tech companies and non-profit companies, must collaborate to build trustworthy, human-centered solutions that uphold dignity and justice for all. Only then digital health can truly serve as a force for good in the global healthcare ecosystem. Now, question: AI risk, is it about cost or is it about bias? Is it about speed or is it about usage? Anybody can tell? No, they telling. Answer is bias. Because AI can have unfair outcomes. We assume that AI is giving correct answer, but it's not because it is trained in a different way under different circumstances. Next, telemedicine issue. Is the telemedicine issue is about speed? Is it about the privacy or the access or the cost? Which means the answer it's about the privacy. Because in telemedicine, data risks are there. Without consent, we may be giving too much of data for outsiders. So to restrict what kind of data we should be enabled to be shared and what should not be shared. Then ethical leadership and transparent decision making in modern healthcare. Okay. So what is healthcare governance? Let's try first. So healthcare governance refers to the system of leadership, accountability, and decision making. It shapes healthcare services or manage and delivery. It ensures that efficiency, integrity, both are there along with fairness in operations. Good governance builds the public trust. So, if you have the good governance, then you have aligning institutions or actions for ethical standards and patient needs. It defines who makes the decisions, how they are made, and who is responsible for the outcomes. So, these guidelines requires from the healthcare people who are there in top positions. In today's complex healthcare environment, governance has evolved beyond hospital administration. So, it's not just one hospital or two hospitals. It should include people from quality assurance. It should include people who are able to have compliances and transparency for equitable access for all the people concerned, IT people, and adherence to moral and legal principles. So people from different sectors within the same system for healthcare have to come together in order to assure healthcare governance. And core functions of healthcare governance means it involves strategic directions, informed decision making, developing the policies, procedures, and practices, and monitoring the performance and ensuring accountability to the patients, staff, and all the community involved. So, all the stakeholders basically, okay, and not only the patient and staff, and nurses, doctors, and pharmacists, and all the people who are accompanying them, it establishes clear lines of responsibility and ensures that decisions are evidence based. So all such decisions should be evidence based, not for the just of sake of rules and regulations to be blindly followed, and it should ethically also sound good and morally also. So core functions of healthcare governance includes all these things. Three pillars of ethical governance means doing what is right. So ethical governance ensures that decisions are fair, transparent, and justifiable. It protects dignity and prevents misuse of power, especially for the sake of money. And doing what is fair, honesty, fairness, respect are foundational. This cannot be compromised upon. Every decision must reflect the moral values, not personal gain or political pressure. Participation and inclusivity in governance. So, when you start some kind of campaigns in the governance, ethical governance is not from just top to down. It has to percolate and it has to be matured enough to be handled at all levels, including all the staff. It values input from the patients, it values input from the staff members, from the communities, and everyone's information is to be given a thorough afterthought. So, when stakeholders are included in decision making, policies become more relevant and accepted and effective. So, this inclusive approach strengthens trust and ensures equitable outcomes. Ethical principles in action. So in a remote area where people are cannot be reaching there easily, there are hardships to reach there, ensuring equitable access to care for rural populations. Transparency in financing, for example, electronic health records, health information exchange, e-learning and training for the people, and health information portals, how to access AI and data analytics is about financial reporting of what's happening through transparent models and allocation of resources during a crisis where the budget may be limited but still allocation matters the most. The principles are more important in governance decision making. So let's say case study in crisis. So pandemic resource allocation during a severe pandemic, government health department faces shortage of ventilators. They had lesser ventilators. The medical team had to decide how to allocate them amongst the patient of varying chances of survival. And the ethical governance framework, who needed the most and who can survive because of this ventilator. So the ethical governance framework guided process decisions were based upon the medical urgency. Patient age was also considered. Comorbidities, how much risk the patient is at, and the principles of justice was also considered. An ethics committee was formed to review each case and ensuring transparency and fairness. So they should be able to logically make a decision as to what is the basis of arriving at a particular decision, because they have to be answerable at the end of taking a decision. So patients were informed of the criteria, families were consulted, they were also told and convinced that this approach and this balanced approach is necessity. It's a clinical necessity with moral responsibility in preventing favoritism and maintaining public trust. So the process was later audited and published, and reinforced accountability, transparency was ensured during pandemic. So ethical decision making in crisis is all about following a clear ethical protocol, prioritize the patient's higher survival probability, and consider age and comorbidities, and ensure no discrimination based on socio-economic status, because enabling healthcare reach the need. Everyone who needs the healthcare should be provided ethically. Case study in data governance. Breach in patient privacy. So this case led to in a hospital CHR, electrical electronic health record. It was compromised, suddenly exposing the sensitive patient data, and patient privacy was lost. The incident occurred due to weak cyber security. People managing the information system, database protocols, because of lack of trained staff, and data privacy was lost. The hospital leadership faced public backlash and legal scrutiny. Like it got the footage was shared amongst the public that they have lost the data. In response, the institution formed the data governance committee to all the data handling practices. So they implemented strict access controls, authorized people with encrypted data storage, and mandatory training on what is a privacy law, why it should not be shared with anyone other than the people who are concerned. So the public statement was issued explaining the breach. The steps were taken and measures were taken to prevent recurrence of such breach of patient privacy. This incident highlighted the ethical responsibility of protecting the patient dignity and importance of transparency in data governance. So what we have learned from this data breach was immediate response has to be taken. The breach revealed a gap in ethical oversight and institutional accountability. Long-term reforms also have to be taken, not just immediate but long-term. The hospital issued a public apology. So in the newspaper also sometimes they say sorry. I mean, due to certain unavoidable circumstances, technical breach of data has happened. Notified affected patients and launched an internal investigation committee was formed and trying to know what went wrong. So conclusion of takeaways from this, we have seen all these things already. Now coming to question. Governance ensures profit, accountability, speed, or marketing. Who's there? No one is there. So governance ensures accountability, okay, because governance has to ensure finally the ethical decisions. It's about accountability. Who is accountable for what is known as governance. Next, inclusive governance is always top to down. Inclusive governance is about participation of all the members. It's only for the government to bother about inclusive governance. And inclusive governance means private people only worry about the inclusive governance. Let me see this. Correct answer is participation, stakeholder involvement. So inclusive governance means participation at all the levels of the hierarchy. Okay, so what are support mechanisms? We'll see a little bit. So support mechanisms are the backbone of healthcare delivery. Support mechanism should have all the provisions. They should have financial management, human resource administration, information systems, logistics, and supply chain management, community engagement are all coming under support mechanism. While not directly involved in patient treatment, they ensure that care is coordinated, accessible, and sustainable over a long period. So, ethical oversight of these mechanisms ensures that operations serve the public good rather than private interests. So, when managed with integrity, support systems promote equity, transparency, and accountability across all levels of care. So it all HR, finance, IT, logistics, community engagement. Support systems have to provide what? Transparency, equity, and accountability. So in order to know that, core support mechanisms should know how this equity and equitable resources. Healthcare financing ensures that equitable access to medical services by allocating funds based on need and population size. So what kind of population requires what kind of allotment of funds. Transparent funding models reduce the disparity between urban and rural areas and prevent exploitation of vulnerable groups. So, the book about understanding healthcare economics is written Managing Our Career in Evolving Healthcare System by Jane Wendell, Teresa Serrat, and William O'Donoghue. Yeah. So, understanding healthcare economics makes you more versatile in order to know why decisions are taken in a specific way by the healthcare community. Ethical challenges in health financing, equity in resource allocation. So, ethical financing prioritizes preventive healthcare. Ethically, they should know where the allotment of money and funding and medicines have to go because it should reach the underserved population. Requires public disclosure. At the end of the day, public has to be able to be known and they have to be disclosed at various places because they should know the spending patterns to prevent the corruption and ensure the trust among citizens. So, not only equity but transparency in financial decisions are to be there. All the individuals, regardless of income, location, should have the fair access to essential health services. This means funding must be distributed based upon the need of the population, not wealth of the population or not political influence of the population. So, transparency in financial decisions have to be taken at a higher level. Ethics in healthcare information systems. So, patient data is very, very crucial. It is about taking consent, it is about taking confidentiality. The strict usage of the data has to be has to be kept till certain number of years. So health information systems must serve clinical and public health goals. So it's not just for the patient, it is for the public health goal, and it has to be kept without compromising the individual rights. Because anybody can ask that information later on. All the any department may ask. Food department, health department, and then inspection. WHO may ask. State government may ask that data. Central government may ask. Any department for enabling the surveillance to happen easily. So all the ethics in healthcare information systems have to be managed carefully, and proper records have to be maintained. Ethical dimension across means ensuring fair access to medicines and vaccines to all the people. Everybody should get it. Conducting all tests by healthcare workers for child and maternal health. Okay, they have to consider the distance of the primary care center to all the public, and then protecting the patient privacy. Okay, through secure vaccination storage systems. So ethics is not just about taking care of the people; it's about taking care of all the medicines and storage systems. Ethics is there. having multiple dimensions across the support functions. Like it can be from viewed from the supply chain management, it can be viewed from the HR perspective, from the sales and marketing. Although less in the healthcare, they are not entitled to do the sales and marketing as much as other industries. So ensuring the fair and access for how ethics have to be maintained across all the support functions. Now, there could be some challenges which people may face in some regions, like poor road connectivity is one bottleneck. Another problem is cold chain interruptions, as we were taught last class. Medical staff shortages are there in certain areas. Then we got inventory management, mismanagement of inventory is there in various districts or something like that. So these are some of the bottlenecks in supplies. And this is about vaccine spoilage, and if it is not maintained ethically and information is not maintained within EHR and all those things, then this may act as a disadvantage. Now, distribution of vaccine, which was dealt in the previous class, is also from the same, like how this gets manufactured from production packaging, then it comes to the regional hub and it goes into the walk-in coolers. Then it goes to the district hospital in the refrigerated vans. It must be stored cool, otherwise it will lose its impact. Then it doesn't worry. Like, I mean, it doesn't work. The effectiveness of the vaccine doesn't work if it is not kept in refrigerated vans. Then village PHCs, ice lined refrigerators, and finally ASHA worker. Okay, so vaccines, the portable vaccine carrier, the one who carries vaccine to the last user. So vaccine requires strict temperature control, 2 to 8 degrees from the factory to the patient. Real world application of ethical principles we have seen first in rural India. In rural India, the government health initiative faces criticism. Basically, they say always it is less allocated compared to urban hospitals. After a public outcry, the independent ethics committee reviewed that distribution model is faulty, and only the wealthier regions are getting money, and due to disproportionate funding due to outdated data and political bias. So the committee recommended a needs-based allocation system using population density, disease prevalence, and poverty levels. So they came to these variables. They came to know that where population density is more, where disease prevalence is more, where poverty levels are also more. As a result, rural clinics received increased funding, leading to an improved maternal and child health outcomes. This case highlights the importance of transparency, equity, and community input in public health financing decisions. It shows how ethical oversight can correct the systemic biases. So ethical oversight also is required in order to know and correct the systemic biases and restore the public trust. So ethical financing is important in rural India. The impact of ethical financing reforms in rural India means this kind of reform was able to lead to a 30% increase in access to primary healthcare centers in rural India, with 25% reduction in out of pocket expenses for rural. Because in rural, as it is, the income in rural households is less. If the government doesn't have the primary healthcare centers also, then healthcare becomes unaffordable for large masses, which is a rural mass. So, community health workers reported higher satisfaction because of such a reform, ethical financing reform, and service quality and responsiveness also improved over a long period of time. The case in point example has been taken from African country, but it is also applicable in under Indian conditions. Then we see another case is ethical supply chain during a global vaccine rollout. So some nations, wealthier populations, they had huge centers to store the medicine and the delayed distribution, and due to giving money and all those corruption, the problem was there in those countries. In contrast, low income country implemented a transparent risk based allocation system. So how certain countries were good in handling this case was the value of human being given to this citizen was equal. Equity and transparency was managed in low income countries. So vaccines were prioritized for healthcare workers. Early elderly citizens and people with pre-existing conditions like morbidities and all was given importance. The country also has established a public oversight committee to monitor the procurement and distribution. So this approach ensured the fairness and reduced waste and maintained public trust. So because of that, so the countries which were well equipped to handle this kind of ethical supply chain during the vaccine rollout were able to fight against the deadly pandemic. So the case demonstrates that ethical supply chain management is not just about logistics. It is about justice, equity, and moral responsibility in times of crisis. So we have seen equity in access and transparency and accountability. The country's success was recognized by the WHO as a model for equitable vaccine access. So it should become a model for other countries to follow. It also leads to a stronger community engagement and greater confidence in public health institutions. Transparency and accountability. Vaccines were distributed based upon vulnerability, not geography or income. So this ensured that the most at-risk population received the protection first. All the time now, we are getting a few minutes later. The call for ethical governance in all support mechanisms. These calls for understanding all the aspects. Okay, so we have reached the end of the session. A few more questions. Financing is based upon wealth, need, politics, and location. Let's see the answer quickly. Financing is based upon the need because of the principle of equity. Info systems ensure profit, confidentiality, speed, and access. Information systems ensure profit, confidentiality, speed, and access. Information systems are more focusing on confidentiality, especially in the healthcare sector, to protect the data and all the sectors. From this, today there's a law that even the AI video has to be written that it is copyright. C has to be mentioned. That is made by AI and not real. So from today onwards, um, the act has come that anybody who's creating artificial thing have to declare that it is artificial. Confidentiality is most important to protect the data. There's a new act, DPDP Act, Data Digital Data Personal Data Protection Act has also come. Next, partnership focus. Is it focusing on profit? Is it on equity? Is it about speed or competition? The partnership focus should be on equity in healthcare sector because the fair access has to be there. Partnership benefit is what? Is it because of less? Is the benefit is about less accountability that partnership is giving, or resource sharing is done? That's why we are using a partnership, or cost. Cost is reduced because of partnership, or centralization is there. Anybody's answering, trying to answer. Creating visible, huh? Resource sharing. Huh? Let's see, partnership benefit. Resource sharing. Huh. Correct. The word collaboration. Partnership is for resource sharing and collaboration. Fine. This comes to the end of my class, and building ethical partnerships for global health impact has come to a conclusion. Thank you, one and all. Can share last class in this class also. PPT, I don't have time right now. I'll give it and share it probably through some people whose email or one or two I have. They can put it on the group later. Have a nice time.